Good evening. My name is Dr. Mack. I'm excited to be here to present about a particular health profession, which is clinical medical assisting. I'll kind of explain the path to medical assisting, what it entails, a little bit about the program that I worked for as well as we go through this. And of course, if you guys have questions, you can definitely reach out to me after, and I'd be glad to answer any questions that you may have. So without further ado, we'll get started. So I'll just tell you a little bit about my background, mainly because of the roots that I have with the Stride program and how important the outreach programs are for me personally. I am a true Seminole. I got all of my educational background through Florida State University. So I'm really excited to always, represent Florida State in that way. I have a bachelor's degree in exercise sciences. I also did the Bridge to Clinical Medicine program, and I got my Doctor of Medicine at FSU. So if you have questions about any of those things, especially the Bridge program, then feel free to reach out to me for that as well. And my roots in the Stride pipeline go very deep. My path or my position in the pathway started in 2004 with a program that was called the Rural Introduction to Pre-Medical Education. So this was before Stride got its name and before we started to call the summer program a Stride Summer Institute. It was a 3-week long program where we was residential, just like the Stride Summer Institute is now, except it was 3 weeks for one group. And we stayed on campus and we got a chance to immerse ourselves into college life and an introduction to medical school and to medical professions and healthcare. And so that's really what got me on the right track towards the path of medicine. I also worked with the Stride program with Leon County, as well as Gaston County Stride as an in-school mentor and a presenter. I also worked with the Stride Summer Institute as a mentor. So I got a chance to work with a similar program that I had gone through when I was in high school. So that was not only nostalgic, but it just really came full circle. So I thought that was a great opportunity. I served as the Gaston County Stride coordinator for a few years, and my last position at Florida State was within our outreach department as well, with student services and community initiatives. And so now it's important to also note that in addition to having your degree, you can also have multiple certifications. You can be an instructor. So I am an instructor for basic life support, which is CPR and AED use. I know as a Stride student, many of you do basic CPR training. The BLS is more CPR for health professions. Advanced cardiac life support, as well as pediatric advanced life support. So I do some of the advanced courses that are related to CPR. And I'm also a certified clinical medical assistant. So I am the thing that I'm going to talk about today with you is a career as a medical assistant. So as you know, the world of healthcare is vast. There's so many different jobs and careers, opportunities, volunteer opportunities. And as many of you are on a path to medicine, you may find yourselves changing throughout the time that you're on that path. It may be that you choose different jobs or different certifications in order to get closer to where you want to be, which is a lot of what many students who are at Florida State do when it comes to the clinical medical assisting program, which I'll talk more about. But just realize that healthcare is vast. So the healthcare system, you probably hear reference to a lot in the news. You probably hear about it in blogs, on TikTok, all the things that you're using now, really, pertains to the whole organization. So all the individuals, all the establishments, all of the offices, all of the people, the resources that deliver care to members of the population. And those members can be specific, and those areas of healthcare are specific to the needs of certain communities. So you may have a specialty area, if you will. You may have a specialty in pediatrics. You may specialize in obstetrics and gynecology. So there are different areas and different services that you may provide as a part of the healthcare system. Most members of that team are able to do both clinical and administrative duties. So I just want to explain that very briefly. When we think about clinical duties, we're thinking about hands-on work, working with patients. So actually doing things that directly impact patient care. And the administrative piece, which sometimes goes unrecognized or not recognized enough, is really important because someone has to manage the systems, the communication, the prescriptions that are going out to patients, making sure that everything stays on track, making sure that if 10 years from now you need your immunization record, you can call someone or fax someone or email someone and have that information sent to you. That's kind of that administrative role. So most of the members of the healthcare team are going to be involved in both aspects. And we call that cross training, when you can do both clinical and administrative aspects of healthcare. So I have a couple of questions that I wanted to, ask you, or a couple of questions that I wanted to present and for you to think about. One is, who is the leader of the healthcare team? So, take a moment to think about, who do you feel like is in charge of the healthcare team or in charge of patient care at any given moment? And, if you think about it, I think for many of you, the first response that will come to your mind is the provider, such as the doctor or a PA or a nurse practitioner. But I do want to challenge you to think of it a little bit differently. When we think about healthcare as a team, you may have a team captain, you may have team leaders who can help to orchestrate the team and direct the team, but ultimately every person has leadership capabilities and leadership skills that they'll exercise as a part of that team. So as a clinical medical assistant, which is what we're going to talk about today, you are a leader of the team. You are in charge of your patients for certain amounts of time. Now, of course, your scope of practice, which is what you actually can do, what your field of experience is a little bit different from a doctor or a nurse, but you are in charge at different points of that patient's care. So I really want you to kind of think of every member of the team as being important, equally important, but just having different roles and responsibilities. And we'll talk more about what those roles and responsibilities are for a medical assistant. And then, think about some of the health careers that interest you. Many of you may be thinking that you want to be doctors. You may think that, I love surgery. I want to do surgery. That seems cool. I remember being a little kid and pediatrics was the area that I wanted because working with children was something I could relate to the most now that I look back on it. But a lot of kids are like, I want to be a pediatrician. I want to be an obstetrician. You have these different ideas. Just realize that there's so many different opportunities. So never feel that you're closed or that you're in a box when it comes to healthcare. One of the greatest things that I've come to learn about medicine is that not only can you do a lot of different things, but you can change your career multiple times and you can change the way that career looks for you. So some doctors, some friends of mine no longer work in private practice or in any kind of group practice. They travel and they're literally going all over the world to take care of lots of different patients in different settings, and that works for them. So just realize that the world of healthcare is very large. It's much larger than the small circle of healthcare providers that you may have been exposed to so far. So let's talk about it. Let's talk about what a certified clinical medical assistant is. One of the reasons why it's important to talk about this field is because it is growing and it is in high demand. Most cities of the United States are in constant need of certified clinical medical assistants. I'm located in Tallahassee and we're looking for CMAs all the time for all of the medical practices, for the hospitals, for home health agencies. There's a lot of different places and a lot of different positions that CMAs can hold. And so let's talk about what that is. So clinical medical assistants are going to be those people who work right alongside the providers. So they typically work with PAs, which are physician assistants. In some places, they may be called physician associates. They may work with nurse practitioners. They may work with doctorates of nurse practitioner or nursing practice. They may work with RNs and LPNs, which are registered nurses and licensed practical nurses. And of course, they work with physicians. And physicians may fall into two categories. They may be medical doctors, or they may be doctors of osteopathy, so osteopathic physicians. So they really are kind of the right hand in medicine, which is why they're called medical assistants. It really is literally what it sounds like. And they can work in a lot of different settings. As I mentioned, hospitals, home health. Home health is becoming a really huge field as well, where you're working with patients who are limited in their mobility or limited based on other factors, and they can't get help outside of their home, and so you go to them, or it may be safer for them to have their healthcare taking place at home, as well as what we call ambulatory care settings. So that's kind of like when you're not in the hospital, but you go to a clinic or a doctor's office for care. That's where we see most of our medical assistants, in those ambulatory care settings. So as a medical assistant, your scope of practice is very broad, but there are some limitations. So you are going to do a lot of clinical intake, which means talking to patients, finding out what patients' stories are, finding out what patients are going through, documenting their story. Why are you here today? That's the more common question you may hear a medical assistant ask you. Anytime you go to the doctor's office and someone says your name and calls you back and takes your height, your weight, your blood pressure, those are medical assistants in most cases. Now, every now and then they're nurses, but we're seeing a greater and greater number of those people being medical assistants. They may also do things what we call point of care testing. So if you have certain symptoms, they can run tests right then and there, even before you're seen by one of the medical providers, to figure out what's going on. So for example, I'll use some of the symptoms that I've had recently. You may have a runny nose, a cough, a fever. Right away, the medical assistant's thinking this could be COVID, this could be the flu, this could be strep, and they can do those tests before you're even seen by the provider, so that some results can be given to you and some results can be given to the provider to get you seen quickly, to get you processed, to get you the right medication and the right answer. They may even do things like a urine test or a pregnancy test, or tests for allergies, lots of different point of care testing. They can administer some medications. So sometimes your medical assistants are going to give you your vaccinations, for example. They may also give other types of injections, and then they help with other services. So any kind of health services that you may need as a patient, medical assistants can help you with. Now, again, there is scope of practice. I have to mention that it is limited and that medical assistants can't diagnose you. So they may run diagnostic tests, but they can't give you the final diagnosis. They don't treat your conditions. They don't give you instructions unless directed by a provider. So they're literally getting their cues and their directions from the medical provider who's seeing you at the time that you're there. So let's talk about some of the roles and responsibilities of clinical medical assistants. So again, as I mentioned, ambulatory care settings, those outpatient settings, not being in the hospital, but going to be checked up. You're going to provide quality care. We're going to focus, especially with our training, we focus on your professionalism, the way that you interact with patients, the way that you talk to people, the way that you understand people from different backgrounds and consider their different needs. It's going to be really important that you interact effectively with patients, considering all of patients' needs, patients' barriers to communication. That could be a language barrier. It could be a barrier related to how much information a patient knows. So just being sensitive to the needs that a patient has, making sure that patients are safe, and of course, assisting the provider with any kind of in-office work that needs to be done. It's really important that medical assistants are great note takers. So if you're someone who can take really good notes, who pays attention when others are talking, who can document, so typing and writing are a big piece of this, using proper grammar, knowing how to summarize points that are given or points that you hear, really important, because all of that has to go into what we call the electronic health record, which is a big record on the computer system that keeps track of everything that a patient says and everything that happens with that patient. So it's really important because medical assistants have to really pay attention to detail. Again, as I mentioned before, they do have a dual responsibility when it comes to clinical as well as administrative duties. So greeting patients, handling phones. That might sound basic, like, okay, who can't answer a phone? It's actually more complicated than it seems, because you have to be pleasant, you have to be attentive, you have to remember to write down who you talk to, their contact information, find out what's going on with them, know how to redirect their call to the right people if you're not the right person for them to talk to take messages. It's really important to pay attention to who can get a patient's medical information and who can't. That's really important. So just because someone calls and says, hey, I want to know What's going on with Miranda? What's her blood pressure looking like? Doesn't mean that you have the authority or the opportunity to give that patient's information to whoever that individual may be. So there's certain laws, in particular HIPAA laws, that medical assistants are following and paying really close attention to. And as I mentioned before, clinical things like taking medical history, drawing labs. So if you go and get your blood drawn, a lot of times those are medical assistants or phlebotomists. And medical assistants do learn phlebotomy, which is the act of actually taking blood from your vein to send off for laboratory testing. So they're able to do that. And some of those other things are listed there as well that we've talked about previously. In addition to that, it's really important to focus on professionalism as a medical assistant. So every job that you have, you want to put your best foot forward, be professional, adhere to the appropriate dress. For a medical assistant, appropriate dress means scrubs, matching top and bottom, clean, ironed, neat scrubs, having good personal hygiene, having short nails. So we don't allow students who are in our medical assisting programs to have long nails or acrylic nails because there's a lot of bacteria that can grow underneath acrylic nails. We really value wearing the personal protective equipment that's necessary. So having a mask, wearing gloves, being punctual, being on time, that's so important. Showing up for your obligations, that's one of the hallmarks in healthcare that you really need to pay attention to when it comes to professionalism, is being on time and being reliable, being someone that people can depend on. Sometimes medical assistants are the first ones to get there. They're opening up the offices and they may be the last to leave to close the practice. So it's really important to be someone that we can rely on. Having a really strong work ethic is also important. So not taking it for granted that you're engaging with patients, not taking it for granted that you have the opportunity to serve, but really showing up and giving your best effort. Open-mindedness, all those different factors that you see here are important for the profession. And this is just another picture. So this picture kind of shows what the uniform looks like. So again, clean nails, neat, your hair pulled back away from your face, because imagine you don't want your hair in a patient's face or falling in the way when you're trying to address patients. Having a name badge that's clear and visible where they can see your name and your credentials, introducing yourself in the right way. The only thing I would say is missing, I would say two things missing from this uniform are a stethoscope and a watch. We really value having a watch with a second hand, so not an electronic watch or a watch that's connected to your phone, but a watch where you could take blood pressure and you can count pulse and things of that nature. So how do you do this? How do you become a certified clinical medical assistant? Believe it or not, some people do this in high school. Some people do it right after high school. Many students, especially FSU students, because you guys are in Stride, I want to talk a little bit about FSU students choosing to do this, because as a pre-med or pre-health student, whether you want to be a doctor, a nurse, a physical therapist, a pharmacist, one of the things that a physician assistant or associate, one of the things that becomes really important is direct patient care. Having experience working with people. It's not enough to have a job at Chick-fil-A, that's great, but you also want to show that you care about the profession that you want to go into and that you've had direct patient contact. And so a lot of people choose to become certified clinical medical assistants while they're in college. So these people are very, very motivated because they're taking our courses or the courses elsewhere. They're also doing their college classes, and then they're working in the field. They're working and seeing patients, whether it's during the week or on the weekends. So let's talk about how to do that. So healthcare experience is always good. It's always a plus, but it's not required. It's just something that is preferred, that you have a little experience, whether it's volunteering or shadowing, something that kind of gives you an idea of how the healthcare system works and how the medical office works. And then the typical training course usually lasts 1 to 2 years. One of the unique things about the course that I teach in that program that I work for, which is Florida Health Science Consulting, is that we have an expedited course that allows you to get it within 1 week or 10 weeks. It kind of depends on the pace that you want to choose. And it's a 40-hour course. So that's one of the things that attracts a lot of students to us. They don't want to spend 1 to 2 years in school as you would at some of the other certifying schools in order to get this certification. They really want to get it quicker so that they can get right into patient care. And most of our students have the background, the anatomy, the medical terminology. A lot of the classes that you guys are taking, even as STRIVE students, put you in the right position to take a course like this. And then after you take the course, some people choose to do clinical internship, which is voluntary training with us. Others choose to go straight into the exam. Either way, the culminating factor is taking the National Healthcare Association, NHA, certification exam. And that's 180 questions, multiple choice, and you have to have a scale score of 390 out of 500 in order to become a medical assistant. My program in particular has a 98% pass rate. So we do a really good job of training students, not only to pass the test, but also in the clinical skills, which I have a few slides to show you pictures of things that our students are doing. So here we have, I'll start on the right, kind of my right-hand corner. We've got two students. One is acting as a patient. So she's seated and is about to get her blood pressure taken, other vital signs taken. And one student is standing as a medical assistant. So that person is actually interviewing the patient. And if you can see, it's a little bit small, but the patient has a script in her hand. And a part of the reason for that is we have our students to actually go through a mock situation, go through a situation that shows like, hey, this is your patient, here's their script, this is what they present with. How would you address this patient? How would you handle the orders that the provider is giving you for that patient? So we have that here. In the middle, we have a teaching assistant and a student and some other students, and they're actually practicing the phlebotomy, so venipunctures. We do have students practice on each other. So in school, you will learn how to take blood from veins, and you'll learn that on your classmates. You'll learn EKGs in your classmates, so how to check for heart rhythms using the machinery that we have for EKGs. You'll learn how to test urine, how to test blood glucose. You'll learn blood sugar. You'll learn all those different things in the course. I do have a small video. Let's see if it'll play for us. This shows a demonstration by one of our teaching assistants. And if it's not obvious, that is my hand. That person, I volunteered myself for the teaching assistant to draw blood from my hand. This is what we call a butterfly venipuncture. And the students were so nervous to watch this happen. They were freaking out, literally, because it's a very small needle and it's going into my hand. So they were okay with the needles into their arms for the venipunctures, straight needles, but they were a little nervous about this one. But I happen to have a really nice, strong hand vein that I was willing to lend. And we have our teaching assistant kind of explaining how that works. So I'm just going to let this play a little bit so you guys can kind of see what we do with that. And, that's pretty much it. So with our clinical assisting program, we allow students to get real-time, hands-on experience with medical assisting, with all the things that you need to do as someone who's interested in a career as a medical assistant. And eventually, like I said, a lot of our students go on to professional schools like medical school, PA school, and the like. So thank you guys so much. Do you have any questions for me? All right, was the NHA certification exam difficult? Thank you. That was a really good question. It was not difficult. I will say that I have to admit that it's a little different for me taking the exam because I had already graduated from medical school and I'm teaching the class. So I took it in part to help me with knowing how to help my students pass exam. We have a really great study guide. And I would say that if you follow the study guide and you actively participate in the course, the NHA exam is a piece of cake. It's very simple. It's not as hard as ACT, SAT, it's nothing like that. So it's one of those things that a lot of people who don't go to college, who choose to go into the healthcare careers before maybe even going on to further their education, they take this exam. So it's not complicated. You need about a 6th grade reading level in order to take the test and to pass the questions, but it does require studying and preparation. So it's a good question. Any other questions that you can think of? How did I pay for college? Good. Did I apply for scholarships? Very good question. So for me, I will say my path was a little bit different from most. I was not a rich kid. I did not come from a rich family at all. My family could not afford to do anything to contribute to my college path. So it was all open for me to figure it out. Great thing about it is that there are so many scholarships that you can get. So yes, I applied to everything that I could. One of the things that I did was I went to, scholarships.com. I looked, at the time we had something called College Board, and I don't know if that still exists, but there are a lot of resources on College Board that talk about scholarships. I applied for local scholarships, so scholarships in my county, in my school, or in the city, anywhere that I could find free money, I applied for it. And I got a lot of those scholarships. The other piece of the way I paid for college was Bright Futures. So that didn't require my parents to do anything. That required me to make the grade and to get the ACT score or the SAT score. And because I got the grade and the score, I got a 100% scholarship. And so that covered all of my tuition, all of my books. So I actually went to school completely for free for college because of the fact that I applied myself and I worked really, really hard to get the grades in order to do that. But if you're not able to get even the 100%, you can get 75%, you can get 50%. So even a partial scholarship can be helpful. And there are always scholarship opportunities all along as you're going through school. Any other questions you can think of? Obstacles I faced in my career. That we could be here all night for it. So I'll make a long story short. I would say the greatest obstacle, if I'm completely honest, is believing in myself. It's very easy to feel overwhelmed when you get to college, when you get to medical school. Everybody's smart, everybody makes all A's, everybody is that person from their school who was the top of their class. So now you're no longer at the top, you're amongst peers who are very much on the same level, maybe even beyond where you are. And I think one of the most challenging pieces for me was not psyching myself out, not getting anxious about how well I was doing compared to my classmates. Learning how to study was another challenge. So what I did in high school did not work for college. What I did in college did not work for med school. So realizing that you always have to go back to the beginning and start over, which is great to do. Figure out what works for you. How do you absorb information? Working in study groups. I had never studied with people in my life before med school, so I didn't know what that was like to actually bounce ideas off of other people and to be accountable to a group. So that was difficult. So I would say that as well. And then sometimes when it comes to careers, sometimes things don't go the way that you planned, but there's always another way. So there's always another door that opens, another opportunity, another path that you can take that ends up being exactly where you need to be. So it may not feel like it in the moment, but there are always ways to get around any obstacle that you face. One of the things that I wish I had paid a lot more attention to was the power of mentorship. So paying attention to people who had done it already and following their advice, not thinking that I had to figure it all out on my own. And a part of that was just because it came from a situation where I had to figure things out on my own. But having programs like Stride, having mentors, having coordinators, please, ask as many questions as possible, reach out to as many people as possible, don't ever feel like it's a dumb question. Don't ever feel like you're bothering someone. Bother them, knock on the door, email them, go crazy if you need to, because you want to get as much information as possible to be successful. So I would say those were some of the challenges that I faced. Just the need to believe in myself more, the need to reach out and speak up when I had difficulties, and learning how to study. And studying is lifelong. So studying doesn't stop when you get your degree. You have to continue to study. I'm studying to this day. I study every single week, something related to medicine or healthcare, because I want to give the most accurate and effective and efficient information that I can to the students that I teach in all of the different capacities. And I want to stay up on what's going on. So medicine changes, healthcare changes. And so you want to really see it as a lifelong learning opportunity. Any other questions? Those are all great questions. Some advice to students going into the medical field. Yes, absolutely. Glad to give some advice. So number one is knowing that it's okay to change your mind throughout the course of that time. It's okay if you decide, oh, I don't want to do pediatrics anymore. I want to do family medicine. So you can change. That's one of the good things about it. You're not stuck in any one particular field. Number two is just realizing that it is a long road, but you can do it. So knowing, again, having that confidence in yourself, knowing that you can do it, getting as much hands-on patient experience as possible, getting as much exposure to healthcare as possible, getting, mentorship, I want to say, is important because it happens in multiple layers. On one level, you have mentors or you have peers that you're going to work with very closely. The next step of your mentorship is going to be people who are one step ahead of you. So maybe people who are 1 to 2 years ahead of your path. Maybe they're in college already while you're in high school, or maybe they're in med school when you're in college. So people who are a couple of years ahead of you who can say, oh, let me tell you what I learned while I was on that path. The next layer of mentorship are people who are right where you want to be one day. So it's not just having a mentor who is a few steps ahead, but it's having someone who's actually practicing in what you want to do. So if you want to be a doctor, you want to have a physician mentor. So it's almost like having peers in high school that you connect with, having, you know, your counselors that you talk to, having someone in college to relate to, having someone in med school to talk to, and having someone who's actually a doctor who you can actually have all those different layers and get all of the mentorship that you need along the way. That's going to be really important. And again, just working hard. There's no shortcut. There's no way around working hard, giving your all, and being as involved in what you're doing as possible, and knowing that things that are important will be repeated over and over. So things that you learn in 8th grade biology are going to come back again. You will have to see it again. Things that you learn in basic chemistry will come back again. So just, again, getting into the habit of constantly reviewing, constantly being open to learn, and realizing that people fail many times along that path. That's really where you get to success. It may be a class, it may be a test, it may be another opportunity, and that's okay. You learn from whatever mistakes that you make and you keep going. So having the fortitude and the resilience to keep pressing forward. That would be some of the advice that I would give to someone going into the medical field. Anything else you can think of? Definitely appreciate you, Jennifer, for being here and asking those questions, and actively participating. Glad to talk to you, and as you know, Miss Jody and as well as Rosalind, they have my information. So if you ever have more questions and want to reach out, you're welcome to do that at any time. Absolutely, you're absolutely welcome.
Yeah, thank you. I just wanted to say, like, your PowerPoint was amazing. I wish I had someone to teach me those advices before I.
Me too. That's what it's all about. Me too.
Yeah, so good thing this is recorded, so we can.
Oh yeah.
Yeah, I'm glad we
going.
This was a great session. Very good.
Thank you. Appreciate you guys so much. Thanks for having me.
Thank you for coming.
Sure.
So do I have any questions? It was just like medical assistant questions, like,
sure.
Like where do most medical assistants find work? Like, I guess it's a good question.
I would say for us, it really depends. If they go through our program, we do help with job placement. So we have a internship opportunity that students do after they finish the course that allows them to volunteer. Usually it's about 100 hours. So they volunteer a lot. They do a lot of volunteering, and a lot of those facilities will hire them after, because it's almost like on the job live interview every week. The other piece of that is we advertise jobs to our students, but outside of that, kind of the normal ways that people find jobs. So you can go on LinkedIn, you can go on Indeed, any kind of job posting websites. You can actually call a lot of the facilities. So in Tallahassee, Patients First, always hiring, by the way. A lot of TMH physician offices, always hiring. There is HCA, which has taken over what used to be Capital Regional. So it's HCA, the Healthcare Association. They have lots of opportunities. So really, it's easy to find a job. It's harder for the employers to find people who are willing to do the work and who are available. So that's pretty easy to do. Like I said, either through our program, there are other programs in town. As I mentioned, those programs are a little bit lengthier. So Lively Technical College has a program, and Kaiser University has a program. So we're not the only program in town, but those programs take a little bit longer. But all of those programs will help you find jobs and help direct you when it comes to your path to finding MA jobs.
Yeah, I remember. Like they sent an email like, "Hey, we have a job opening," and I applied.
Yeah. So it pretty much works the same way. The only improvement I've made to that system is I've made a course. So it's a course on Moodle, just like the Moodle classes were, and they can enroll themselves, and then they'll get every week. I'm always posting jobs, so they can go look at the job board and see what's available. So that's something new that I instituted to try to help get the word out. And it helps us too when we lose contact with students sometimes when they're gone from the program, if they can have a place to reference and go back and look for jobs.
That's amazing.
Yeah.
All right. Well, I guess that's it.
Okay.
I hope everyone has a great afternoon.
You guys as well. Thank you.
Thank you so much.
Thank you. Good to see both of you again.
Good to
Yeah.
see you.
Thank you, Jennifer.